All right. So one of the things that we like to use a lot, both Dr. Ben and I have one. We recommend them quite a bit. Is a vibration plate. Now, you can go on Amazon and get one anywhere between about $80 to $300. They're very, very reasonable on price, especially considering like the old power plates and stuff like that used to run like $2,800 or more. So they're really, really great tool to have in your home. Now, when we're trying to kind of work on neurology, um, a lot of times vibration plates are kind of known to help move the lymphatic system and stuff like that, which is great, help with blood flow and all that. But what you want to start doing is when you're trying to get the most neurologic benefit is you incorporate complex movement with it. So your cerebellum and your brain in general, uh, what keeps a brain healthy is its ability to adapt and have to fire the whole range of motion of the joint. So a lot of times what winds up happening is when we have just repetitive movement patterns and stuff like that for like a hip or an ankle, what happens is we wind up only using certain parts of that joint repeatedly and the other parts we just never even access. So what happens is the brain over time, those pathways that stabilize that part of the joint, they kind of get weaker. So all of a sudden we start having some neurologic issues or weakness in a joint or stiffness or some continual problems there. What happens is the brain says, well, I'm not really familiar with that part of the joint anymore. I don't use it a whole lot. So when you're on the vibration plate, besides just standing on it, one of the things that I tell people to do is you want to do variations of movement on it. So one of the simple ones is you put 1 foot on the vibration plate, 1 foot off, and do some imbalanced squats. Okay. And then you kind of switch over and you do some more. You kind of do some step on, step off. You put one in the middle because a lot of times the vibration plate are oscillating and things like that. One in the middle, one on the side. Not only that, sometimes you're like, okay, well, that kind of starts being like a workout. And I don't know, I'm not careful, like, especially if we have balance issues. Some people are like, well, that's kind of scary to do that balance. You can do a step on and step off as well. Just kind of creating more movement. One of the other things you could do is you can set it like in front of the couch if you're watching TV or something, and set your feet on it, and you roll up to your tippy toes and back to your heels, up to your tippy toes, back to yours. But then you kind of roll in and you roll out, and then you do figure eights. So your heels are sitting on the vibration plate, and you just put your toes in figure eights, or do like spell cursive the cursive alphabet. So what you're just trying to do is do exaggerated motion, especially through the ankle. And then, like I said, you can kind of get through, you can actually even sit on it. You can sit on it and roll your hip. You can do kind of stretches through it, like put your knee and do almost a lunge through it. So again, the biggest goal with the vibration plate, that it's way more than just standing on it. If you really want to start engaging neurology more, then you have to incorporate complex movements. That is the primary goal when you're using a vibration plate for neuropathies and balance and all that, is you're trying to increase the complexity of movement through the joints that are on the vibration plate. So that's the primary take-home tip for vibration plates. They're fantastic. Again, they work on multiple levels, but you're trying to increase the complexity of the nerve signals going to the brain. And then that means the brain will then in turn adapt and be able to increase its connection with that joint.